Hi, I'm here with Stephanie, who's graciously agreed to be a volunteer doing tri-brain trauma therapy. Thanks, Steph.
No problem.
Tell me, what are you dealing with at this point in time? Any issue you want to work on?
A little bit of social anxiety.
Okay. Can you tell me a little bit more about that? When do you experience the social anxiety?
Anytime I need to speak or present my ideas or even talk about personal things in relationships and business, especially relationships that matter a lot to me.
Well, let's go ahead. Now, the first thing I do in tri-brain trauma theory is make sure that my polarity is established so that I'm able to test her in an appropriate manner. So what I'm going to do is put a finger over my front lip and down below, above my belly button and below, and on these 4 acupressure points, I'm going to rub for about 20 seconds. And that will establish my polarity so that I can test her without getting opposite results. Let me take an arm, Steph, and we're going to have you put the elbow nice and straight, and we're going to be above the wrist and moving this way. I want you to resist that. Breathe out, though, and don't hold the muscles in your chest or the abdomen. You're isolating here. We're not checking strength, we're checking energy. So do me a favor and hold. Good. So a strong indicator muscle is showing fine, so we can use this muscle. Now what I'm going to do is check the polarity point to make sure that your brain is running the right way so that we can get good results. So I'm going to put a finger right above the brow, or the nose, bridge of the nose. Breathe out. And when it weakens, it tells me that her polarity is correct, which means that the right side of the brain is taking care of the left side of the body. You can go ahead and put that arm down and rest it. And the left side of the brain is sending messages to the right side of the body, and that means the prefrontal cortex is on, and that's what we want to be able to establish good polarity and be able to have reliable results with muscle testing. So consciously, what you're telling me is that you've got some social anxiety. I'm sure you're right, but I don't know if the subconscious mind or your body is impacted enough by that to be upset with it. Let's check it though.
All right.
Do me a favor and think about that social anxiety. Breathe out. And it seems to agree with you. So what we're going to do is we're going to go to the alarm points on the meridian to check and see what point is going to make that weak arm strong. So what I want you to do is to touch here, breathe out, and if it's weak, it's not the active point. Touch here, and that is not active as well. I'm going to take a shortcut and go to the kidney meridian to check. Breathe out, and that is the active point. Go ahead and put that down. The reason that I went to the kidney meridian is that the emotions in the kidney meridian fit some of the things that Stephanie is talking about, but we need to check out and see if indeed the emotions are there. So what I want you to do is think of fear. Breathe out, and that seems to be accurate. Fear of what, Stephanie?
Fear of being attacked.
Physically?
Verbally, physically, being criticized, yeah.
Think about that. And that fits. That does seem to be what's happening. Concept that it's your fear. Think about that. And that seems to be accurate. Put that down for a second. Usually it's the person's fear, but sometimes they're sensitive to somebody else's fear. This one seems to be yours.
Okay.
So we've got the emotion, we've got the meridian. What I need to know is the concept that there is an earlier event where you've had this kind of fear. So let's check that out. And then we'll check here. Breathe out. And you switched off. So do me a favor and establish polarity. Anytime you get results that don't quite make sense consciously, at least check to see if the polarity is on.